Hi, I'm Dr. Jen from Family Pet Veterinary Centers, and I have Dean here. He is going to read off some questions we've gotten, and I just want to help answer some questions about feline, which is cats, dentistry today.
All right, so why does my cat need anesthesia for teeth cleaning?
Well, in humans, you can just say and in cats, you just really can't tell them that, so we have to be able to look at that. And the problem is that most things are under the gum line. And I think one of the other questions I'm going to jump ahead I'm going to answer ahead of time is, does my cat need dental x-rays? And the simple answer is yes. Without dental x-rays, you're missing 2/3 of the tooth, and 80 to 100% of the cats age 10 plus have dental problems below the gum line. And younger, maybe not quite as fast, but most of them are going to get dental problems in their lifetime, and it can happen very early. And we only found with x-rays. And they'll take an x-ray. I mean, I don't even want to sit still with that thing in my mouth. We have them under anesthesia and we can look very closely. We're talking about very small teeth. These teeth are tiny in comparison to people. And there's only 30 of them, and we need to preserve the 8 structural ones that are served for chewing and for the act like fingers, these big fang canines.
Gotcha.
What else do we have for questions?
So who's going to monitor my cat while it's on anesthesia?
Well, here at Family Pet Veterinary Centers, we have someone dedicated, assigned to them, monitoring anesthesia throughout the entire time. And anesthesia has kind of been known as one of those scary things. The risk of a problem in cats is 0.11%. So it's not 0, but it is less than 1. In fact, it's very, very small. And the reason why that is because we pay close attention, we tailor the drugs to the patient, and we do preoperative workups to make sure we can have the better outcomes. And I think our chance of problem is actually less than that, mainly because of the BNP testing that we can do, because 1 in 7 cats has a problem that you can't hear. You can only find with certain tests, and very few clinics in the area have this kind of testing that we can do. And it's rather economical as well.
Well, that's pretty cool. So will my cat be intubated to have the cat procedure work done?
You definitely want to, because when we're cleaning the mouth, we're cleaning and polishing, but we're rinsing. Dilution's a solution to pollution, and we rinse everything out at the same time. And we want to make sure we protect that airway and make it very comfortable for them and keep things clean. And in doing so, we need to have the airway protected with a tube, but we actually numb them back there a little bit as we place it, and that helps them a lot as well.
Okay. So how long does a cat dental procedure take?
A dental procedure can vary quite a bit. It's usually 30 to 45 minutes to get anesthesia and imaging done, and some cleaning. Probably 45 minutes with most of the cleaning, and then recovery. But when we find a problem, then we want to decide to treat that. And that's where we call you and talk to you about what's going on, make a decision together as what needs to be done, and decide to treat that. And when we do that, that can add very huge amounts of variation in time. I specifically do just dentistry, and we can do advanced things such as root canal therapy, and things like that. And those things can add some time, but we can preserve structure and function without having any disease or pain. So they are good things to do when indicated.
Gotcha. So if my cat does need extractions, will pain medication be given?
Well, one of my other certifications is pain management, and we have my team trained, and we go above and beyond in pain management because we want to have the best outcomes. A little bit of a lot of things gives you the best outcomes without any side effects. And so we're definitely going to prevent pain. We're also going to treat pain should it already be present. Most of the time we're talking about major nerve blocks. And I actually just published a textbook talking about pain management, a chapter for veterinarians on this. And so veterinarians can even learn about it. But this is something that we do every day in practice. We want to make sure our patients are doing well.
Okay. Well, thank you, Dr. Jen. That was all my questions.
Great, thanks.
Mm-hmm.